This is Dr. Angelin Fiona, Assistant Professor from the Department of Periodontics. Today, we are going to explore about the defensive mechanism of the gingiva, which is your gingival crevicular fluid. So, today we are going to see what is gingival crevicular fluid, the methods of collecting it, and what are the clinical implications they are going to have. So, let's get started and move into the topic. From the beginning, what is gingival crevicular fluid? To begin with, I'll just ask you a question. Okay, despite being exposed to so much of chemical, mechanical and the microbial irritations, your tooth and the supporting structures are withstanding and they are maintaining the health. Have you ever thought why it is happening so? Yes, that is because of the defensive mechanisms of your oral cavity. So, we have to see what are the defensive mechanisms of our oral cavity. As you can see, the defensive mechanisms can be divided into either non-specific or specific mechanisms. In case of non-specific mechanisms, you have host microbial symbiosis, that is the maintenance of the homeostasis between the host and the microbial community. And then you have tissue resistance. In tissue resistance, you have either anatomic factors, the mucous barrier, the epithelial barrier and the local inflammatory responses. So, here the mucous barrier actually comprises of the saliva and the gingival crevicular fluid. And the non-specific immune mechanism includes your adaptive immunity, which is nothing but your antigen-antibody reaction. So, today we are going to dig deeper into the gingival crevicular fluid. So, these are the things which you are going to explore today. Mainly, what is gingival crevicular fluid and what are the theories that help in the production of the gingival crevicular fluid and how to collect the gingival crevicular fluid and quantify it, and what are the things that is the composition of the gingival crevicular fluid and the clinical implications they are having. So, coming to the definition. Before knowing the definition of the gingival crevicular fluid, you should know what is a gingival crevice. It is nothing but the V-shaped shallow crevice which is present between tooth on the one side and gingiva on the, that is the sulcular epithelium on the other side. So, gingival crevicular fluid can be defined as a specific serum originating fluid. I think you are all aware of the fact that underneath the epithelium there will be presence of connective tissue, right? So, this connective tissue has so much of blood vessels. Hence, gingival crevicular fluid is found to be originating from the serum, and hence it is called as a serum originating biological fluid which can be found in the periodontal microenvironment. As I told you earlier, they are present in the crevice of the gingiva, that is the gingival sulcus. Hence, they are present in the periodontal microenvironment which can be harvested from the gingival sulcus itself. So, gingival crevicular fluid is defined as a specific serum originating biological fluid that is found in the periodontal microenvironment and which can be harvested from the gingival sulcus. Okay, what is it actually? To know that, you have to know few history. Okay, starting with Black. Black in the year 1899 found that there was some kind of fluid that was present in the sulcus of the gingiva. Whereas in 1959, Brill and Kress are the two scientists who has done a pioneer work in researching about the gingival crevicular fluid. They found it to be a transudate. So, now what is a transudate? Transudate is a serous fluid that originates from the interstitium and they will be exposed into the extracellular spaces. Alright. And then later, Alfano and Pashley in 1974 found that this fluid has been released due to the osmotic gradient. So, what is the osmotic gradient? This is nothing but there will be pressure difference. Imagine your bacterium is taking so much of noxious substances into the epithelium and they reach the basement membrane between the epithelium and the connective tissue, right? When they are getting accumulated there will be pressure on the blood vessels which are present in the connective tissue. This increase in the hydrostatic pressure results in a oozing out of the fluid, which is the gingival crevicular fluid according to Alfano and Pashley. Whereas Bickel in the year 1985 concluded that this gingival crevicular fluid can be a transudate at certain situations and it can be an exudate at certain situations. That is, if the inflammation is less and there is mild gingivitis or healthy gingiva, this GCF can function as a transudate. Whereas in case if inflammation is severe, then it can be acting as an exudate. So, to conclude, this GCF can either be a transudate or an inflammatory exudate. Okay, why there is so much of GCF in inflammatory states whereas non-inflammation doesn't have so much of GCF? To know that, there's nothing but you have to see that around the blood vessels you always have this lymphatic system, right? This lymphatic system will drain the interstitial fluid and the extracellular fluid into the body, right? So, in case of health, when the blood vessels are producing the interstitial fluid, they will be drained by the lymphatics present there. Whereas in case of inflammatory state, that is a high level of inflammation is present, the lymphatic drainage capacity will be exceeded. So, the excess fluid will get accumulated in the sulcus as the gingival crevicular fluid. Now we are going to see how does the GCF is produced. So, as I was telling you earlier, when there is a mechanical irritation or a bacterial irritation, there will be changes occurring inside the microcirculation. When there is changes inside the microcirculation, there will be momentary vessel contraction occurs. When there is contraction of the vessels, the venules will get congested whereas your arterioles will get dilated. When arterial vasodilation is taking place, the vascular permeability of the arterium will also be increased. When there is increase in vascular permeability, obviously there will be exudate formation. That is, your plasma proteins and the fluid will be released into the extracellular spaces. So, this is how the GCF is being produced. Now, coming to the functions of the gingival crevicular fluid. As I was telling you, they are eliminated from the blood vessels, right? So, they will be rich in most of the immune cells. Hence, this gingival crevicular fluid is going to act as a flushing agent. They are going to flush out the gingival sulcus, and as well as when there is microorganisms, they will prevent the microorganisms by acting as a defensive mechanism. And then along with the saliva, they have so many functions like protecting the underlying tissues by the presence of enzymes as well as the immune cells. And then they also maintain the periodontal microenvironment. They also help in holding the junctional epithelium in a correct position. Now, moving on to the methods of collecting GCF. These are few of the methods for collecting GCF, which are the absorbent paper strips, the pre-weighed twisted threads, the capillary tubes or the micropipettes, and the crevicular washing method. So, coming to the absorbent paper strips, Brill first found that this absorbent paper strips should be placed inside the sulcus until a minimal mechanical resistance is felt, whereas this resulted in so much of irritation to the gingival tissues around there, and hence the extrasulcular method has been found by Lowe and Holm Pedersen, which is nothing but keeping the paper strip on the extracellular space, that is at the entry of the gingival crevice. And when you are keeping it, this will get absorbed with the GCF, and then the paper strips will be taken for quantification of the amount of GCF collected. In case of pre-weighed twisted threads, you have to pre-weigh the threads, and then these threads will be kept around the sulcus of the teeth and waited for the GCF to get collected in the threads. And after getting collected, these threads will be weighed again, and the difference between the weight will give you the amount of GCF being collected. Then coming to the capillary tubes method. In this method, capillary tubes will be held on the gingival crevice. So, this capillary tubes, according to Linde, how they function is that the seepage of the gingival fluid gets into the capillary tubes, but this technique has so much of disadvantage in that we have to wait for a long time for the GCF to get collected, as well as the viscosity of the fluid does not allow for the capillary action also. Let's now see how we are going to quantify the collected GCF. So first, it has been found by Brill that your sulcular epithelium can allow the permeability or penetration of any molecule with a molecular weight of about 1000 kilodalton. So he found that this GCF can be stained by fluorescent dyes. So, and then in later days, ninhydrin or India ink are the type of stains that have been used to stain the GCF. So, after collecting the paper strips, they have found that this ninhydrin has stained the paper strips. So, when the stained part of the paper strip will be linearly measured with the help of any vernier caliper or any ruler. And then coming to the next method of quantification. As I told you earlier, they can be pre-weighed and weigh the twisted threads after collecting the GCF. And then other method for quantifying GCF is the use of an electronic instrument called as the periodontal. So now we are going to see about what is the use of periodontal. It has been said that this paper strips, after being collected, when they are placed in the between the electrodes of the periodontal, the wetness of the paper strip will cause the alteration of the fluid flow in the periodontal. This will give you readings from 0 to 200, and this reading will confine to the gingival indices of the patient. So it has been proved that from 0 to 20 implies a healthy gingiva with a gingival index of 0, and 21 to 40 with a mild gingivitis, gingival index of 1, and 41 to 80 gingival index of 2 with a moderate gingivitis, and 81 to 200 reveals that there will be severe gingivitis with a gingival index score of about 3. Now, after collecting GCF, you have quantified the GCF. So, now what you are going to see is that we are going to see about the composition of the gingival crevicular fluid. Imagine your irritation or your mechanical irritation or the microbial irritation, when it occurs afterwards, your bacterium is going to attack the surface. Your bacterium is going to enter into the gingival crevice, right? As I was telling you earlier, there will be connective tissue beneath the epithelium which is rich in blood vessels. So, when your bacterium and the noxious products are coming into picture, your bacterium will release either lipopolysaccharides, endotoxins, or any other hydrogen sulfide because of its metabolic waste products also. These are some of the elements which are released by the bacterium, and afterwards when these noxious substances are released, there will be reaction taking place inside the connective tissue, which is the production of the chemokines, that is your inflammatory mediators. They will come into the picture, and naturally your gingival crevicular fluid and the saliva also have certain antimicrobial peptides also. So when we are going to see about the composition, you can divide it into bacterium and its byproducts and your host immune cells and the damaged host tissues. So we are going to see the composition. Here, what are the metabolic and the bacterial end products? They are, as I was telling you earlier, they are endotoxins, cytotoxic substances, hydrogen sulfide, which will be released as a metabolic end product of the reaction between the bacterium, and the lipopolysaccharides. These are the toxins which are being released by the bacterium. And you know, the periodontal pathogens like Porphyromonas gingivalis or Aggregatibacter actinomycetum comitans will also be present in the gingival crevicular fluid. Now coming to the host part. In host part, as I was telling you earlier, this antimicrobial peptides will be present like the lysozymes, the lactoferrins, leukocytic enzymes, and the myeloperoxidase. These are the antimicrobial peptides which will prevent the proliferation of the bacteria. They will cause the cell death of the bacteria, and they are all involved in lysis of the bacterial products also. And comes into the picture of your host immune cells, which are the inflammatory mediators, namely the cytokines, which includes your pro-inflammatory and the anti-inflammatory cytokines like the interleukin 1 beta, 1 alpha, tumor necrosis factor alpha, transforming growth factor, interferon gamma are some of the inflammatory mediators. And you will also have leukocytes, complement compounds, and your immunoglobulins. and after that there will be production of the enzymes and the inhibitors by both bacterium as well as your host cells, which are going to cause lysis of your bacterial cells as well as your host cells. Which are the components means you're going to see about the collagenases, the matrix metalloproteinases. These are the some of the enzymes that cause the collagenolytic activity, and the neutrophilic products like the neutrophilic elastase, which is going to cause the lysis of the elastic fibers, and there will be increased amount of aspartate aminotransferase, which is going to be increased so much if there is a highest amount of inflammation, and there will be phospholipases which are going to cleave the lipid molecules also. These are the enzymes and inhibitors. When these enzymes and inhibitors cause lysis of your host cells, they will result in the damage of the host tissues. So, what are the damaged host tissues which will be present in the GCF? There will be damaged epithelial cells, desquamated cells, or the presence of the DNA fragments. Other than these things, there will be also electrolytes and certain organic compounds. What are the electrolytes? Namely the sodium, the potassium, and the calcium. This sodium is going to maintain the osmotic gradient of the solution, that is the gingival crevicular fluid, and the potassium, it also maintains the integrity of the cell membrane, and your calcium is going to involve in the cell signaling properties. Other than these things, the organic components like carbohydrates and the proteins are also present in the GCF, like the hexuronic acid, alpha glucuronidase, etc. are also present. And there will be also so much of glucose which is higher than that of the serum. That is, the glucose content of your gingival crevicular fluid is found to be 2 to 6 times more than that of the serum, which means that there will be a metabolic reaction as well as it also shows the influence of the diabetes on the periodontal disease. Okay, after knowing all the compositions, all of these things, what is the clinical significance of the gingival crevicular fluid, and what are the factors that may influence the production of the gingival crevicular fluid? To see that, first we are going to see the factors that affect the production of the gingival crevicular fluid. First thing is circadian periodicity, which is nothing but your biological clock. When you are sleeping at night, your salivary production will be reduced. So, the GCF production will also be reduced. So, when inflammatory reactions are trying to happen, if you wake up in the morning from 6 a.m. to 10 a.m., there will be increase in your GCF production. And it has been said that the sex hormones, especially your estrogen and the progesterone, is going to increase the GCF volume, because these are the hormones which have influence on the vascular permeability. So, when the vascular permeability is increased, obviously there will be increase of the gingival crevicular fluid flow. And due to the mechanical stimulation, that is coarse brushing habits or eating of any large foods or coarse food habits, they are also going to increase the production of the GCF. And smoking is also going to cause a transient increase in the gingival crevicular fluid because of the hyperemia, and smoking causes a vasoconstriction, and to combat for that vasoconstriction there will be vasodilation, which results in the increase in the GCF, that is the gingival crevicular fluid. And the periodontal therapy is also going to increase the gingival crevicular fluid, because when you are doing any surgery or periodontal therapy, we are going to injure the gingival tissues as well as the periodontium. So, this injury results in an increase in inflammation for healing process, which results in an increase in the GCF production. So, what are the clinical significance for gingival crevicular fluid? This gingival crevicular fluid can be used as an excellent diagnostic marker, because they are going to say you how much of inflammation is present with the composition, and if it is increased in amount, we can conclude that it is increased because of the presence of inflammation. And there are many biomarkers which are present in the gingival crevicular fluid that also has an influence on the periodontium as well as the systemic illness. And it has been said that many drugs, especially tetracycline, is going to be 2 to 10 folds increase in GCF compared to the serum. So we can have a targeted therapy and proper periodontal therapy. The other drugs like metronidazole, rifampicin and clarithromycin have also been detected in the gingival crevicular fluid. Now we are going to see the biomarkers in the gingival crevicular fluid. The periodontal biomarkers includes the presence of the collagenases, the matrix metalloproteinases, lactoferrins, C-reactive proteins, which also indicates the presence of a systemic inflammation, and the substance P, the neutrophilic elastase, which is a byproduct of the neutrophils that is going to act on the elastic fibers and cause lysis of them, and aspartate aminotransferase, which is going to be increased due to increase in inflammation, and the phospholipases that are going to cleave the lipid molecules. Other than this, some systemic factors are also increased in GCF. Especially, as I told you earlier, the glucose content of the GCF will be more in case of diabetes patients as well as in case of normal patients also. So it is an excellent biomarker for identifying the diabetes, and there will be increase in the apoptotic enzymes like the caspase-3, and certain obesity markers like leptin and chimerin are also being found in the GCF, which can also be used as a diagnostic tool for diagnosis of the diseases. And as I told you earlier, the collection of GCF is quite difficult and is hectic, whereas we cannot give a clear-cut evidence for collecting the GCF, and we cannot get a clear-cut volume of GCF, and it is difficult to obtain the composition of the GCF. So, in order to overcome these things, nowadays newer Chassid kits have been formulated. These Chassid kits will give you a quicker remedy for identifying the enzymes that are needed. These are some of the Chassid kits which are being available, like the PerioCheck, PerioGuard, which are going to find the amount of aspartate aminotransferase enzyme, the pocket watch, which also identify the amount of aspartate aminotransferase, the prognostic and BioLyse for identifying the elastase, and the topaz for identifying the bacterial toxins and the proteases, and the MMP dipstick method for identifying the MMPs. So far we have seen about the definition, the theories of production of GCF, the methods of collecting GCF, and the methods of quantifying GCF, and then the composition, the biomarkers present in the GCF, and the Chassid kits. Owing to the implants, there is also a fluid called as the peri-implant crevicular fluid. This peri-implant crevicular fluid is also of more importance like the gingival crevicular fluid, because they can also function as a biomarker. To summarize, we have seen about what are the defensive mechanisms of the gingiva and how it is important, and what is the role of GCF in providing the defensive mechanism to the gingiva, the methods of collecting it and the composition of it, and the biomarkers which are present in the GCF that have a clinical significance. I hope we had a very informative session. I will meet you with another interesting topic soon. Thank you.